Hello, hello, hello. How's everybody doing? You hear me and
Hello.
see me?
Yes.
Okay. So turn our cameras on, peeps. Cameras on, cameras on. Okay, dokie. So today is really, I think it's how to answer the questions. And it's really just going to be about the questions because I think a lot of us know content, but really just don't know what to do when we get there and how to rule out and how to get down to two and all of that good stuff. So before we start, first of all, just any questions that you have seen on a test before, questions that you're working on right now that you're like, oh, I have no idea what that means. I love it when you're a talkative group. Yes. Okay. Okay.
No
So
question.
go ahead. Okay. So always, I am not a fan of acronyms. I never have been. I just don't understand how people can process that. And I think people spend so much time processing those acronyms that you're lost in the question. So what we're always going to follow is the social worker problem solving method. And if you remember, you really did learn this in class. You had either an interviewing class or a methods class where this is what you were taught. So I don't think we need all of them all of the time. And I think sometimes some of the other tutors will spend so much time making sure that you learn and understand the acronyms that you're forgetting like the whole process of what I'm even supposed to do. Okay. Am I sharing? So assess, assess, assess. Did I mention assess? Did I mention assess? Assess.
No, you've never mentioned assess.
Thank you very much. Thank you very much. We get paid to be nosy. We get paid to ask questions. That's what we do. Who else can ask adults about their sex life? Who else can ask them if there's enough food in their refrigerator? You ask them their height and weight sometimes, like you, the doctor. We get paid to be nosy. So that is what we do. If I can't assess, if there's no way to gather more information, I know it's an intervention question. That means it's time for me to do something. But I'm always thinking assess, assess, assess first. I can't assess if it's full of feelings or if safety is an issue. Okay. So my safety or your safety. If I am in danger, we are not assessing. No, I'm going home to my kids. Okay. And you need to take care of your kids because safety is first. My safety as well as the client safety. The Code of Ethics does say that I have the right to work in a safe environment. Do you remember seeing that question about it's after hours and you've got a client and he'll be the only one, you'll be the only staff member there after hours? That's usually a question. You're not going to see him because that's danger for you or for the client. And because we're females, we forget from the male therapist viewpoint, right? So if I'm a male therapist, the female is not going to come in and want to see me in my office. And I do not want to put myself in that situation where me and the other opposite gender are in the office together when the only one's there. We don't want to do that. Okay. So yes, the client comes first, but safety, safety, safety is real. If the question deals with feelings, we're going to deal with the feelings. And of course, we always plan with the client, never for the client. Okay. So those are the things we're really trying to remember. And termination starts at the beginning. The minute you write that treatment plan, the treatment plan says it's 4 weeks, 6 weeks, 12 sessions, whatever it says, that's when we're starting to let go. It's not a one-time thing. Oh, by the way, it's over. I hope when you're in your internship, your professor said, on day one, you let them know that you're an intern, right? You'll be gone in 15 weeks. You'll be gone in 12 weeks and you're doing the countdown, right? And especially if you're the closer you work with the clients, it's kids especially, And you know, you told them 17 times and they still are like, you're leaving, what? But you've told them. So it's always a process. So assess, assess, assess. Assess does not mean it means gather information. It means is there anything else I can look at before I intervene? So think of that. That's what I would do first. I'm going to tell you that I think they're all first questions. I know it says next, but I'm still thinking, what would I do first? If that was happening right now, and you know, my kid cut his leg and I put Bactine on it, what would I do next? I put a Band-Aid on it, right? That's still the first thing I would do after I put the Bactine on it. So that's what we're looking for, is making sure you understand that. And the third thing is stay in the question. Stay in the question. Okay. It's a reading test. I cannot tell you enough. It's a reading test. Okay. Now, many of you have tutored with other people. I know TDC says put it in order. Is that what they say do? Maybe, I don't know. How many of you have learned the acronyms?
Yes, they say that.
TDC says put them in order. Like what would you do first, second, third? I don't have time for that. I just don't. My mind doesn't have time for that. I really don't. I'm anxiety ridden already, and I need to just figure out which two it's no way could be the answer, and then go back to the question and then figure out then which two it could be the answer. I'm going to compare the two to each other and go back to the question. Okay. Are there any particular questions, again, that you want to ask me about? Something you've seen someplace, something you've heard someplace that you've seen recently in a study question? Oh, such a lively group here. Okay, let me put up some questions here. Okay, let me share my screen. Okay, so as we go through, remember every question is measuring a KSA. It's measuring a knowledge, skill, or ability. So when I see a question, I'm always trying to think, what are they trying to measure to see if I know? Here. That. Okay. I have like 3 screens here. You over here. You over here. Okay, what do you see?
Some questions.
Number 16?
It's 30,
36.
36.
No,
36.
30.
Yeah, no, I don't want that one yet.
30.
This one. There we go. See screen one, number 36 now. I'm sorry, number there we go. 16.
Yes.
Yes.
Okie dokie. So 16, we'll do that one together. That's just starting off as a simple code of ethics question. Okay. According to the NSW Code of Ethics, a social worker's respect for a client's right to confidentiality. So here's what usually happens is somebody says, oh, I know the answer to that one. And you go and pick your answer and you haven't read all 4 choices. We always read all 4 choices. Okay. And those are just joined when you got to keep your cameras open. I know. Dr. Pam wants to see your face. So I want to see if you understand the question or not. Okay. So then let's read all 4. So I'm going to stay in the question first. Always. According to the Code of Ethics, a social worker's respect for a client's right to confidentiality. Okay. So 1 forbids sharing confidential information revealed by client with others. 2 is left to the worker's discretion. 3 includes sharing information revealed by clients with others without the client consent for compelling reason. Or 4, allow social workers to ignore the court rules. Okay, now we probably all know the answer, but I want you to learn to go through the process. That make sure that you have read all of the questions. Okay, so it's asking me of what the NSW Code of Ethics says for a social worker when it comes to the client's right. Okay, what can I rule out for sure? Somebody.
2.
Okay, it's left to the worker's discretion. Math's not going to work. Okay, very good. What else can I take out?
4.
4.
Okay, so now between 1 and 3. Okay, what's the difference between 1 and 3?
With 3 says
Without client consent,
Without their consent.
without the client consent, that's the difference.
Mhm.
Okay, so what's my answer
Mhm.
then? 1 or 3?
1.
1.
1.
Okay, so 1 says forbids sharing confidence revealed by client with others. This one says includes sharing information revealed by a client with others without client consent. What's that last term? That last sentence there?
For compelling
For compelling reasons.
What does that mean?
Like for court, right? Like you have to have a reason to look them up, a reason to something exaggerated.
So what's my answer?
1.
Dr. Pam, can you
1.
guys talk a little louder? I can't hear on my end.
Hello. Does that help?
I mean,
Is it
just
better?
me, or does Dr. Pam sound far away?
Do I sound far away?
No, I can hear you well.
No, we can hear you loud and clear.
Okay, maybe I'll go on my phone. Okay, sorry about that. Thank you.
That's not a problem. Hold on. Let me make sure I'm on my, yeah. Yeah. Okay. So I'm confused how we get between 1 and 3. Why would we pick 1 over 3?
For compelling reasons.
Well, what,
Question no more.
Are 1 and 3 both true?
with 3, isn't it true? Isn't it true that we still have to get the client's consent?
If they abuse their child, do I have to get their permission?
No.
No.
Well, compelling reasons. So that's that last compelling reasons.
Absolutely. So let me read the
Yeah.
whole question. You were so
Right.
sure it was 1. You didn't give 3 in. You didn't give 3 the time of day. It's like you saw the dude that was tall the first time and you didn't even talk to him. He just picked out number 1 instead of checking out number 3. He might not have been so tall, but he was the better choice. Okay. So yes, it does forbid. A is certainly true. Okay. But what I'm looking for is the best. Does it say the best? No. But I'm
No.
looking for the best of which those what does it mean? Includes sharing information by a client with others without the client consent for compelling reasons. If you tell me you're going to leave my office and go kill somebody, do I need your permission?
No.
No.
Okay. So A is not really true. There's some things I can share. Okay. Now tell me how we got stuck there. Tell me, because a lot of y'all chose 1. Explain to me how we got there.
I think not looking at number 3 fully.
So I think that so many times, oh, I know this one. I know this one. And you might have gone through my process with me, but you didn't really. You were sure number 1 was the answer. So you were just kind of going through the motions. The test is, and that was a simple one, right?
Mhm.
And then you get your scores back. I missed all those ethics questions. Dr. Pam, I'm ethical. I know I am ethical. Test says you ain't. Okay. So we really have to stay in the question. Do you see how simply that can be missed?
Yes.
Okay. Okie dokie. We're just going to go around the room. Who wants to go first?
I'll go.
Okie dokie. Follow the
Yep.
rules. Read the question. Stay in the question. Understand it in your own words where you even look at the answers.
Okay. Experience has shown that some adolescent boys who are rejected by parents and must be placed with another family seem indifferent to the separation and are cheerfully impatient to enter a foster home. Later, when demands of the foster home evokes feelings of frustration, the client fearful of another rejection is often unable to express his real feelings about the new home. To help such a boy to deal with his feelings best, a social worker might comment.
Okay, so what is that? What's that paragraph even telling me? It's like foreign language.
It's saying that some adolescent boys who are rejected by their parents will be placed with a family member, and won't be happy about being separated from the family member going into a foster home.
Who's going in the foster home?
The little boy.
Exactly. Okay. So they're
And,
rejected by their parents, and then they're placed with another family, and that's no big deal, right? Okay, but then we put them in the foster home, and they're excited. Oh, hey, put me in foster care. My kids just say that. Watch me. Okay. We ain't going to no court. I know everybody. Okay. So then later on,
and then later, when he get demands from the foster home, he evokes feelings of frustration. So now once he gets to the foster home, he's frustrated and he's fearful of being rejected again. And he's not able to express his feelings about a new home. So how would the social worker help the boy best deal with his feelings?
okay, a lot of words, right? A
Yeah.
lot of words, okay? And I know that some people say they're distractors. I'm going to tell you that everything in the sentence matters. They put that in there. They give you hints and clues to let you know what we're looking for. Okay. So they're with their parents, and then they went to another family and they said, hey, great, foster care will be great. They go to foster care and foster care is not working, right? Then they're afraid that they're afraid they're going to be rejected again.
Right.
Okay. So the question says then, to help the boy deal with his feelings best, what might be my comment? Okay, let's read all 4.
Okay. Number 1, why were you so glad to get away from your own family if you were in such difficulties, and if you are in such difficulties now? 2, how do you feel about your new home now that you have been there for a while? 3, there is nothing for you to do but make the best of the present situation. And 4, please try to give the same kind of consideration to your foster parents that you would have given to your own parents.
Okay, so let's rule out what can it not be.
I'm gonna rule out 3.
Okay. Hang it up, kid. Ain't nothing you can do now. But not say that. 3 is out.
I'm gonna rule out I'm gonna rule out 2 because I don't know how long he's been there.
Let's keep 2 in for a while.
Mhm.
Okay.
It
I'm
doesn't
a rule,
matter how long he's been there, does it?
no. I'm gonna rule out 1.
So I'm between 2 and 4.
Um, and my final answer would be 2.
Okay. So is that just because we ruled out the rest of them couldn't be it?
Yes. Well, no, because now since he's in his new home, I want to know how he feel. How do he feel about being there? What's his feelings about being there?
Okay. Because he was excited to get to a foster home, right? That's what it says. He was excited to
Yes.
get to a foster home. And now that you're here, what's it really like? Absolutely. Do you know why 1 is always going to be the wrong answer? What in 1 tells me that's never going to be the right answer?
Why were you so glad to get away from?
Anybody?
Why?
Mhm.
Absolutely. We don't ever ask clients why.
Mhm.
If they knew why, they wouldn't be with me. They could figure it out by themselves. We don't ask why. We ask how or when. We don't ask why. Okay? That's just one of the things of being a clinician. We don't ask why. Why'd you do that? Oh no.
It's so hard not to, though. Like when you're talking with clients sometimes. I try to like be
Um,
mindful, not using the word why.
so um I taught parenting classes before I had kids. I thought, okay, this will be easy. But one of the things that I do remember carrying over to my children is don't ask the question if you know the answer. So if I already know the answer, I'm just setting them up for failure. So that's my rationale, not because I know why, because you're stupid, or I know why, because you drank too much. I mean, I know why. I'm not gonna ask the client that. That's like setting them up for failure, right? So that's how I did it and how I remember to do it. We don't it no matter. It doesn't matter why. Okie dokie. 19 volunteers.
Right, I'll go.
Okay.
It says a definition of mental disorder. Wait, a definition of mental disorder in a DSM diagnostic assessment requires.
So this is a recall question, right? This is just recall. You have to just know something about your DSM. Okay, go ahead.
So 1, evidence of any mental illness. 2, a clinically significant impairment or distress that may be supported by observations of friends, coworkers, and relatives. 3, observations of patient's behavior over a 1-month period or a client's agreement with the clinician. So I would eliminate first observations of a patient's behavior over 1 month. Not every diagnosis has 1 month.
Okay.
Then I would eliminate 4, a client's agreement with the clinician.
Okay.
So you're stuck between 1 and 2. 2 says that may be supported by observations of friends, coworkers, and relatives. Wouldn't it be 1? Wait, no, don't guess, sorry.
You say you get blah blah blah. Let's go back. Okay. You got down to 1 or 2, correct?
Yeah.
Okay. So now I'm gonna breathe. Usha. Okay. I'm sorry, namaste. Okay, okay. Now between 1 and 2, what's the difference and which one of those would best answer my question? What is evidence of a mental illness?
Wait, it's 2.
Someone needs to mute themselves. Mute themselves. I still think you're just guessing.
Okay, wait.
Just tell me why. Just tell me why.
Why? No,
How do I know if someone has a mental illness?
by their like presentation, like what they're doing, their behavior, observation.
Okay.
Um,
So like an MSE, if someone comes into me and they don't remember person, place, or thing, they don't know where they're at. Can I diagnose them with that?
Mm.
No. So it's not necessarily just evidence of it, right? It's it's everything. People around them are beginning to notice they can't hold a job, that they're people are calling you going, come get this person. So it has to affect all areas of my life. So when we're looking at diagnosing, especially like ODD and ADHD with kids, it has to impact at least 2 different areas of their life: home and school, school and church, 2 different environments. Okay. So that one is just the best, again, the best answer of that. Okay. So evidence of mental illness is, the answer D is 2 tells me what 1 says. Does that make sense? I know these are hard, Dr. Pam. Why don't you give us easy ones? Everybody knew that, right? Y'all are all good. I got some blank faces. It wasn't just you, so Chloe. All right. Okie dokie. Volunteers.
I'll go. Number 21. I'll
Yes.
go. Okay. A 70-year-old woman cares for her chronically ill 77-year-old husband home. He has a degenerative disease that will eventually make him totally dependent on her. She also has a chronic heart condition and fears that she cannot care for him too much longer. In counseling her and helping her plan for her chronically ill husband, a social worker would seek to,
Say my question.
1, help her assess and
No. Go back to my question.
Okay, in counseling her and helping her plan for her chronically ill husband, a social worker would seek to.
So I want to go back and I want to say the whole stem. She's 70, he's 77,
7.
right?
Mhm.
He's got degenerative heart disease. He's totally dependent on her. She
Mhm.
also has a heart condition and she's afraid that she can't care for him much longer. Okay. And what's her presenting problem?
Yes.
You say what's her presenting problem?
What'd you show up for?
Help
For?
her husband and herself, I guess. Her husband.
No, it's a reading test. It's a reading test. Sticking to the question, okay?
Mhm.
In counseling her
and
and helping her
plan for her
land.
chronically ill husband.
Actually, that's what she came for. Help me. I've got this chronically ill husband. I don't know that I can take care of him much longer. I'm 70. He's 77. Okay. So that's what we want to do, is spend that much time in the question and then get to the answers. Okay. Now read all 4.
1, help her assess and identify the range of choices that are available to her and her husband, such as home care and residential care. 2, persuade her to keep her husband at home and arrange appropriate support. 3, monitor the situation, intervene as necessary. 4, engage extended family members to assist her as condition deteriorates.
So it doesn't say first, but in my mind, what would I do first? Okay. So let's rule out. What will we not do?
3.
Okay. Good. I'm not going to persuade anybody to do anything. This is their life. Good.
3, I wouldn't do 2 or 3.
Okay. Now between 1 and 4.
1.
And tell me why.
I guess because I'm looking at the word help because that's what she gave me for.
So it's her assess. It's an
Yeah,
assess
it says
question.
assess, of course. Yeah, assess.
Exactly. So she's coming in and she's like, I don't know what to do. She came in because she needs to plan for this. I don't know what to do. So let's look at all of the options available for her. Okay. And then next we can intervene and help when she can decide. But the first is my assess question. And I know it doesn't say assess, but still when they come in, I'm not going to tell her what to do. That's her life, not mine. Okay. Very good. Very good. Very good. Okay. Rochelle, take this one.
Okay. A 9-year-old boy lives at home with his remarried mother, stepfather, and three-year-old half sister. The boy is sometimes ignored and mistreated by both his mother and stepfather. The treatment does not rise to the level of severe abuse, but the situation is worsening and the boy is beginning to show signs of emotional disruption. The stepfather seems to resent the boy's presence in the home and has little insight into his own behavior. Both parents claim they do not wish to place the boy. After failing to improve the situation by working with the boy's mother and stepfather, what strategy should the child welfare worker recommend for the boy's welfare? So in the question, we have a 9-year-old boy. He's with his mother, his stepfather, and his 3-year-old sister. The boy is being mistreated, it says, by both his mom and the stepfather, but it's not severe abuse. But the situation is getting bad and he's starting to show signs of emotional disruption. And the stepfather really don't pay the boy any attention in the home, and he really don't have that much insight of his own behavior. They don't want to place him in a foster home, but the situation is getting worse. So the question is also asking, what strategy as a child welfare worker should I recommend for the boy's welfare?
Absolutely. Okay.
Okay. Number one, temporary foster home placement to prevent further mistreatment while the parents receive treatment. Number two, permanent separation of the boy from his family as the best means of preventing his continued exposure to the unsatisfactory pressures in the household. Number three, placement of the boy and a stern warning to the parents that similar action will be taken on the behalf of the younger child should the situation warrant. 4, temporary placement of the boy with a foster family until the stepfather is no longer in the household. So we're gonna rule out 4,
Okay.
because the stepfather's gonna be in the household. We're gonna rule out.
Where did you see that?
Huh?
Where did you see the stepfather's going to be in the household?
I mean, I'm just saying. I mean, there is
Did
nowhere
you
in the
did you
question
did you
saying
see?
that.
Okay, then we can't don't put any more there. It doesn't say that yet, does it? Did you see someplace where it says he refused to leave?
No, that's why I said I'm ruling it out.
Okay. But I can't rule it in or out yet. Let me hold on to that one.
Okay.
Does it say the
Um,
stepfather agrees to leave or he doesn't agree to leave?
no, none of
It doesn't
that's
say
in
anything
there.
about it, right? So I'm not going to rule that out yet. Let me just hold on. I'm not saying it's the right answer, but let me not rule that one out yet. Because you're
Okay.
assuming
Okay.
some things that it didn't say.
Okay. And
Okay,
number
so
3,
number 3, go ahead.
it says the placement of the boy in a stern warning to the parents that similar action will be taken on behalf of the younger child should the situation warrant. Because we're looking for a recommendation for the boy's welfare, so I don't think 3 would be appropriate.
Okay. What about 2?
I'm reading it. Because we looking for a recommendation for the boys' welfare. Because in the question, it doesn't say it's to the point where he needs to be removed from the home, and the stepfather and the mom, they don't want to, place him anywhere.
So 2 says permanent, 1 says temporary.
Permanent separation.
So I don't think I can do permanent
2.
yet, can I?
No. So we wouldn't do 2 nor 3.
So I'm between
So
1
we're
and
left with
4.
4. Let me see. Temporary foster home place to prevent further mistreatment while the parents receive treatment. Or 4, temporary placement of the boy with a foster family until the stepfather is no longer in the household. I think ain't no thing. The answer is 1.
Now why? It is 1. Very good. Now tell me why.
Because it's temporary foster home placement because right now in the question it said the level of it says does not rise to the level of severe abuse, but the situation is getting worse and the child is showing signs of emotional disruption.
I get it, but why does he need to be away from both parents instead of just one parent? What in the question tells me that he needs to be away from both parents?
Because the boy is sometimes ignored and mistreated by both his mom and stepfather.
There we go. That's our proof in the question. Okay.
Yeah.
That's what we're looking for. Okay. So we should have got down to 1 to 4, go back to the question. And it didn't say that the father wouldn't leave. I can't assume that, can I? But he doesn't need to be around either one of them because the question says they've both been mistreated. They both mistreated him. Did we see that?
Yeah.
Dr. Pat, I have a question. Hold on. So it says while the parents receive treatment. So how do we know that the parents are going to receive treatment?
Oh, you are so. Then the question asks you that?
No.
Then don't think it.
No.
Unless it asks you that, if it were measuring parent treatment, it would let you know that. They're not measuring that. Okay. So we're staying in the question. And you may find a question, you'll see questions that says the parents have been given their time to, they've had 18 months to get their stuff together and they haven't, right? Then we move forward to terminating parental rights. But in this question, that's not what it's measuring. This was a safety question, just making sure that kid was safe. They see that?
Yes, I see it.
It was just a safety question.
I guess for me, it says temporary foster home placement to prevent further mistreatment. Okay. While the parents receive treatment. So where in them does it say that the parents are going to receive treatment?
So the question is, what would I do as the social worker? I need to get that kid out of the home. That's the safety part. The only two that are temporary are 1 and 4. I can't permanently place a kid just by on this little bit of information. So 2 and I'm not going to do 3. Place them and give them a stern warning. Don't do that again.
Yeah.
Okay. So of the 4, we can't do permanent. We don't get to take a kid out and put them permanently. Parents have to jump through hoops. And we go back to court for 18, 20, 19,000 years, right? Before the judge TPRs parental rights. Okay. A little bit of diagnostic here. Was that a sigh? Sister, take this one. No sighing.
Mr. Green, a talented computer programmer, believes that he is so valuable to his firm that he will be promoted soon to the senior staff. and asked to advise the board on strategic policies. At the same time, he is certain that some recent problems at work are attributable to his supervisor. He has no concrete evidence to support either of his beliefs. Mr. Green believes his supervisor is not giving him sufficient credit and is belittling his skills and contribution in discussion with senior staffs of the company. He also suspects that his supervisor enters mistakes into his programs to disturb his performance, his professional reputation. Briefly, one would suspect, okay, so Mr. Green is a computer program. I mean, he's talented as a computer programmist, and he thinks he's valuable in his job, and he assumes like he'll be promoted soon to be at the position of advising the board on certain policies. But at the same time, he is convinced that some problems of his job are attributed to the supervisors, though he has no concrete facts or evidence to support his beliefs. Mr. Green also believes that his supervisor is not giving him credit for what he's doing and sometimes belittle his skills and contribution with senior staffs of the company. So he suspects that his supervisors enters mistakes in his program to disturb his professional reputation. So they're asking, according to this scenario, how will we briefly describe Mr. Green? Is he a narcissistic personality, paranoid personality disorder, sociopathic personality, or compulsive personality disorder? So what I will remove first is the sociopathic personality disorder.
So we know that's not a term. It's called antisocial, right?
Correct.
And sociopath is not a term. So antisocial are my serial killers. Okay.
Correct.
So 3 is out.
Then I'll eliminate 4 also. There's no compulsivity in his attitude. So 3 and 4 is out. Between narcissistic personality and paranoid personality disorder, I know, I mean, paranoid personality, he's kind of like showing the suspicious that saying things which it is not, but at the same time, paranoid personality does not claim like they're the savior. So I will,
Say again, say again to that last thing.
Sorry, that like personalities, paranoid personality disorder individuals don't claim like they know everything about like the way this man is putting himself. So that will make me eliminate that and say he's a narcissistic. So he thinks like he knows it all. He's the best one.
Which do I have more evidence of? Narcissism or personality or paranoid?
It's paranoid, but paranoid does not have the other aspect that they're showing.
But narcissists aren't paranoid.
Are they?
Narcissists aren't paranoid.
Okay, then it will be 2 then.
I just have more evidence to show he's a paranoid. I don't, and that, so the top line says he's a talented computer and he believes he's very valuable to the firm and he'll be promoted soon to senior staff. That doesn't mean he doesn't think his stuff don't stink, right? Narcissists think that, you know, I'm the best thing since God's green earth. It doesn't say that he's the best, you know, this company can't run without me. It doesn't say things like that, right? So it's really more of that that paranoid. You're putting stuff, you're planting stuff in my files, right? You don't give me credit, you're belittling my skills. So that's a paranoid personality disorder. Okay. Remember, personality disorders are ingrained. Are they egosyntonic or ego-dystonic?
Dystonic.
Paranoid disorder, personality disorders are ego.
No. Dystonic is when they dislike it, so they are not conscious of it, so it's syntonic.
Exactly, they don't have a problem. Ego-syntonic, I mean they're in sync with their ego. Absolutely, very good, very good. Okay, so again, this is the one that was just a recall. So I have to know my personality disorders well enough to know what it can be and what it can't be. And remember, they've been that way since childhood. It is not something that is the only 2 we can diagnose before 18 are borderlines and antisocials. We can diagnose both at 16. Everybody else is not till 18. '26. Mary, you want this one?
I guess I'll go.
Tiffany has time to turn. I can skip you and go to Tiffany if you'd rather.
Okay, go to Tiffany.
It's like, damn, girl.
Of the following, the most characteristic trait of obsessive compulsive personality disorder is
Do you know the difference between OCD and OCPD?
a little bit. I know that this is in cluster C.
Okay.
I know that the main difference with OCPD versus OCD is the need to like constantly check on things over and over. You don't do that with OCPD.
Correct. Okay. OCD also, they'll come for treatment, right? They think they have a problem. OCPD, the personality disorder, they don't think they have a problem. Let me just show to make sure everybody knows that there is a difference. A lot of people just don't know there's a difference. Usually I'll say 1 in 4 when I tutor. People in the mental health profession just seem to have a higher rate of OCPD. I just don't know why. Of 1, 2, 3, 4, 5, 6, 7, 8, there's about 8 in here. So usually 2 of you are obsessive compulsive. Your closets things are in order. Your refrigerator, everything is just so perfect, or the cabinets, they're lined up by like alphabetical order or expiration dates or something like that. Okay. If you went in my closet right now, you would just probably just cry. My daughter's OCD, and she's like, Mom, I couldn't even go to work. I'm like, whatever, I'll figure it out. So OCPD, personality disorder, been that way your whole life. If I ask your mama, she would say when you were little, she was lining up her little Barbies, and they had to be lined up by the hair color, and her bed was always made, and little shoes are put in the place, right? She brought little Barbie pink shoes, they were probably all stacked up in the right place too, right? So OCPD just want to be perfect. Okay, you don't think you have a problem. The people that around you think you have a problem because they're getting tired of you having everything has to be in place. I canceled I was doing counseling with a couple one time, and she I'm from South Florida, and they owned a boat, and he wanted to spend the weekend on the water, and she could not go out until the house was immaculate. Oh, that's OCPD. She didn't think it was a problem. He had a problem with it. OCD people are the people that the compulsions are the actions, the obsessions are the thoughts. The obsessions won't go away. Okay. There's bugs on my hands. I didn't wash my hands. Can't you see the bugs? Can't you see? I feel dirty. I've got to shower over and over again. It won't go away. Okay. So they're easily identified. These get worse over time. People with OCD will come for therapy. They do not like this one little bit. Okay. So OCPD, they strive for perfection. OCD, the blue, they're the ones that will come because they can't function. They're late to work because they have to go back home and check the oven 7 times to make sure they turn the oven off. Okay. So now 26.
Okay, so of the following, the most characteristic trait of obsessive compulsive personality disorder is 1, ambivalence, 2, intelligence, 3, dependency, or 4, veracity.
You know what veracity means?
That means that you have kind of a spirit to keep going and going.
It actually just means
Isn't
it's more, it means truthfulness. I'll always seek the truth.
Okay. It's the screen jumping with you, or is it just my screen?
Are there little green men on your screen too?
No.
Do you hear anybody's other voices than mine?
It's like going side to side really fast. Let's see.
Did it stop?
No.
You might just need to log out, log back in.
But let's see about answering this first. Okay. Traits. Okay, I would strike out. Well, yeah.
It's not 4.
Hmm?
It's not 4.
Okay. I would strike out. I would strike out 1.
That's my answer.
That's your answer?
You know why?
I guess. I don't know. Are they just? I don't know.
Because they're ambivalent.
They don't have a problem.
And
So
Because
ambivalence
they're egocentric.
yeah, okay, whatever.
Okay.
Whatever. Okay. So like what do you mean my husband's mad at me? His house is clean, isn't it? They have no desire to change.
Okay.
$29. Let's go there. Margo?
I was like, yes. Okay. An unmarried mother refuses to reveal the name of the child's father, but wishes to relinquish the child for adoption. Okay. Recent court cases have created precedents that could jeopardize a legal adoption if the father's approval is not sought. Oh, I didn't know that. Moreover, knowledge of the father's background is important for health reasons. The caseworker decides to first, okay, so it's an unmarried mother who refuses to reveal the name of the child's father. And she wishes to let go of the child for adoption. She's relinquishing. So unmarried mother wants to let go of the child for adoption. Recent court cases have created precedents that could jeopardize a legal adoption if the father's approval is not sought. So if the father does not approve, then they can go to court, or she can go to court. He could take her to court. Moreover, knowledge of the father's background is important for health reasons. Ooh. The caseworker decides to first ask the court to insist if the interest of the child that the mother discloses this information, refuse to give the mother service until she gives this information, attempt to elicit this information through interviews with the parents or close friends of the unmarried mother. Sorry, we're in California and the 49ers are playing. Yeah. Attempt to help the mother see the value of giving this information to the agency. So this is going to be a hard one, Dr. Pam.
Okay. So let's stay in the question. Make sure we understand the question first.
So the mother's refusing to reveal the name of the child's father.
Mm-hmm.
The hospital needs to know. Wait. So the mother refuses to give the father's name and wants to put the child for adoption. So recent court cases have been created. And if she doesn't get the father's approval, then she can get sued. So moreover,
not necessarily her, but the adoption agency could be sued. And the biological father could come back later and try to take the baby. So a lot of legal things could happen.
Like you didn't get my consent, my permission.
Mm-hmm.
Moreover, knowledge of the father's background is important for health reasons. So that's the problem. Knowledge of the father's background is important for health reasons. The caseworker decides to first. So first is like, what would you do? It's like right now. Do I ask the court to insist in the interest of the child that the mother discloses this information? So ask the court to insist. I don't understand what that means, to insist.
Issue a court order.
Okay, so ask the court for a court order in the interest of the child that the mother discloses the information. Okay. Refuse to give the mother service until she gives information. So we're not going to do B, scratch out 2. Attempt to elicit this information through interviews with the parents or close friends of the unmarried mother. I don't know if that's attempt to help the mother see the value of giving this information to the agency. So I'm going to go off on a cliff.
We're going to rule out first. We're going to rule out.
So I'm going to rule out 1, 2, and 3.
Okay.
And I'm going to 4.
You are absolutely. You are absolutely.
Oh my,
Absolutely.
difficult.
Very
Okay.
good. Why 4? Does everybody see why it's 4?
So attempt to help the mother, because I'm helping the mother to see the value, because
Got it.
you're going to get sued and you don't want to go to court.
Okay. And I mean, and I can do one. I definitely can do one. We can go to court and we can have the judge issue a court order, and we can do the DNA on the baby, and you know, he can lock her up for not telling. The judge can do that. But is that where I want to start?
Oh yeah. Mm-hmm.
Right. I want to start with first. So this would be an engage before I assess.
Engage.
Because I'm trying to build that rapport with her. Because if I can build that rapport with her, then, so remember the therapeutic alliance is the most important thing.
Right.
I can do one though. I sure can. I don't want to do one first though. I'd rather just get mom. Let's be on the same page, mom.
So I think what scares me is attempt to help. I kind of feel like that's kind of coercing. Like
you're putting too many words in there. If they wanted you to coerce, they would tell you.
Okay.
They really would. It is just a reading test. It would say, confront the mother and let her know if they really would. Okay.
Okay. So that's where I get tripped up is I put too much on it.
If that's all it says, they're not trying to trick you. They're really, really not. $36. It's got their camera closed. Kylie, is that you? I don't know if she's there or not. Chloe, are you driving? Zoe, are you driving? I don't hear you, but I think she's driving. We'll come back to you. Okay, we'll go back.
I can go.
Okay.
I'll try this one. During a first interview, a young married woman who has recently given birth to her first child complains of loss of appetite and inability to sleep. She seems somewhat disheveled, if I said that right, and disorganized, displays a mournful demeanor, and says she feels unmotivated and overworked. The social worker's first activity would be
What's happening in the question?
She seems somewhat disheveled and disorganized, displays a mournful demeanor, and says she feels unmotivated and overworked. The social worker's first activity would be to 1, assess the suicidal risk, 2, determine the frequency and duration of symptoms, 3, record a thorough history, 4, provide reassurance now that the client has sought treatment. I want to take out 3 and 4.
Okay, they're between 1 and 2.
I kind of want to say assess the suicidal risk, but
go back to the question. Go back to the question.
She seems somewhat disabled.
Disheveled means like her clothes are all off, and and she didn't wash their hair, combed or brushed her hair, like your Saturday morning,
Probably
maybe just me.
Maybe determine the frequency and duration of symptoms.
Still tell me why. What words in the question?
What words in a question?
Mhm.
Unmotivated, overworked, disorganized.
So when they go out of the way to mention that she just had a baby, that matters.
Yeah.
If she just had a baby, what am I worried about?
Her mental, her ability to how
Postpartum
she's doing,
depression.
how she's postpartum depression, how she's doing.
Postpartum depression.
Yeah.
That's
After
what I'm
she has a
worried
baby.
about. Okay. She just had a baby. She's feeling overwhelmed. And I don't know if you breastfed, you felt like you're a cow and like their milk was sicking out everywhere and you're like just feeling gross and yucky and like, ah. Okay. So, okay, that was just me. So okay. And it's like she's like mournful and she's probably not getting any sleep. All those things are going on because she just had a baby. Okay. And when I say don't read anything into that, when they're telling me she just had a baby, that's what I've got to remember. They said that for a reason. Okay. So the first thing I want to know is how long has it been going on? Okay. That helps me determine whether it's postpartum or whether it's major depression, and I need to look at it differently.
Okay.
Okay. So that's when they put in the question that she just gave birth to her first child. Okay.
Okay.
That would probably be under normal human behavior. Okay. So I'm not diagnosing her. So normal, when we're talking about the KSAs of where it would go, what would measure, this would probably be a normal human behavior. It's quite normal for women to go through postpartum stuff after they've had their baby. I don't have enough to diagnose her yet until I find out more information.
What was the answer to this one?
You tell me.
It's 2. It's 2.
Because when I first looked at it, I thought it was 1.
So tell me why. What are the words I'm looking for suicidal?
Well, I was saying disabled, disorganized, displaying a mournful demeanor. And
do you see hopelessness?
Yeah, words like that. Yeah,
do you see hopelessness in here though?
No, I do not.
That's a big sign. Hopelessness. I can't do this anymore. I can't get up anymore. She's sad. But I need to know, she just gave birth. Was it 2 weeks ago? Was it 6 months ago? I don't know that. So I need to gather more information, and there's not enough information for me to risk her, ask her for suicide yet. Hopelessness is the word that I usually look for.
Okay.
Okay, Dr. Pam. So I was with her in the sense of assess for suicidal risk because it again, she just gave birth, and I also thought of postpartum depression. So I would have gone with 1 as well. So are you saying, because I know also when you see hopelessness or helplessness, that's usually assessed.
That's the words I'm looking for. Yeah.
Okay. So number 2 as well. I was teeter-tottering, but I went towards 1 more. So in the future, the questions, if we do see something like this and we don't see that the client's feeling hopeless or helpless, then we would stray away from suicidal risk.
I want you to go back and read the whole question. In this particular question, that she just had a baby, and they go out of their way to tell you she just had a baby, that means something. If it said it was a 45-year-old man who was recently divorced and he lost his job and his wife and all that good stuff, I'm assessing for suicide because we know that population has a very high rate of suicide. This one, she just gave birth. There's not enough in for me to be worried that she's about to kill herself.
Okay. I was just thinking I had it.
Because you try to stick with rules, and every question is different.
Right.
We have to go back to the question. What does this particular question? And that's what the test is looking at. Do you know if the sky is blue and the grass is green and it's 4 o'clock on Tuesday, you got a 16-year-old boy, blah, blah, blah. In this specific situation, what would you do? In the next situation, you might assess because they might not be talking about a mother who gave birth. Okay, so let go of some of the rules that you've always heard and read the question. Did I mention those reading tests? Did I mention that? Okay, just okay. In case I didn't mention that before, it's a reading test. Okay, hold on. Let's see. I want to go down to more, less recall and more. Let's do that one. 52. Rochelle? Mary had the last one, right? Rochelle?
Okay. A group of newly married men meets in an educational group to discuss concerns about intimacy. This is their first meeting, but they have agreed to attend weekly meetings for at least 3 months. As one man discussed difficulties in communication with his wife, the worker noticed a discrepancy between the content and the emotional tone. The worker would, so in this question, it's a group for men that have just got married and they're discussing their concerns of intimacy. They're meeting for the first time. They have agreed to attend weekly meetings for at least 3 months. And one man discussed his issues with communication with his wife. The worker noticed there is a discrepancy between how this man is communicating, the content and his emotional tone. So it says the worker would.
So hold on, let's stay in the question. Okay. This question is measuring your knowledge of groups.
Mm-hmm.
That's
Okay.
what it's measuring. Okay. So remember, everything is a KSA, a knowledge, skill, or ability. This is
Okay.
measuring. Do you know how groups run? Forming,
Okay.
storming, norming, performing, right? And then it's over. So I know it's their first meeting.
Mm-hmm.
Right. So they're in the first meeting, they're just talking to me. They're not talking to anybody else. They're just talking to me. The goal of group, right, is to go from being very much group led, leader led, to going over here to being group led. So I just get to sit back and say nothing and do nothing. Okay. So now I know it's their first group, and I know that there's a discrepancy between the content and the tone. What does that mean?
The what he's saying and his tone don't match up.
Incongruency also, right?
Yeah. Mm-hmm. Mm-hmm.
You know, when your husband says, "Are you mad?" and you're like, "I'm fine."
Yeah, but
We know you ain't fine, don't we? Why don't he know you're not fine? Because we're going to be fine. It's not matching. It's not matching. It's incongruent. Okay. So I'm lying. That's what that means.
Yeah.
So now let's read all four.
Okay. Number 1, allow the group to pick up on the discrepancy. Number 2, speak to the client about a referral to a caseworker since he seems to have strong, unexpressed feelings. Number 3, reflect that the client seems to have strong, unexpressed feelings about the matter. 4, ask the client if he might want to have couples counseling since the issue seems difficult to discuss.
Okay, let's rule out.
Okay, so I won't rule out 2. Speak to the client about a referral to a caseworker since he seems to have strong, unexpressed feelings.
Good, that's out.
Rule out 2. 4, ask the client if he might want to have couples counseling since the issue seems difficult to discuss.
Okay, 4 is out.
I take out 2 and 4. Now I'm left with 1 and 3. 3, reflect that the client seems to have strong, unexpressed feelings about the matter. 1, allow the group to pick up on the discrepancy. Well, this is their first meeting. I would do 3, reflect that the client seems to have strong, unexpressed feelings about the matter.
Do you see that in the question?
No.
He's lying, but I don't know what he's lying about, do I?
No.
Answer is 1.
Okay.
Tell me why. Anybody, tell me
This is
why.
this is
In
their
group,
Because
this
it's a
the first
group,
time
it's a
they
group
meet.
section. It's a group.
Hold on. Sister is so sweet. She won't talk over you. Go ahead, sister.
in group therapy, when there's any conflict, the group has to kind of like, they're the ones to raise the issue as compared to the therapist being in control. So the group might have also discovered the discrepancy. So we'll let the group kind of like handle it.
Okay. And they might have noticed it once. So it's the first session, right?
Correct.
But if you keep coming 12 weeks, week after week after week, I'm going to pick up on the fact that you're lying.
Correct.
And then the group can handle it. Absolutely. Absolutely. Okay. So reflect that the client seems to have strong unexpressed feelings about the matter. So I'm not really sure I can prove that. All I know is the man discusses difficulty in communication with his wife. And I notice a discrepancy between the content and the tone. I don't know if he has a lot of unexpressed emotional feelings or if he's just lying to me.
Okay.
So something's not matching, but I don't know which it is. Okay. If he got up and he was angry and he yelled at somebody inappropriately and brought up some like transference stuff, then I could say, okay, there's some feelings there we need to work on. But at this point, I don't know. I don't know. It's just, he's lying. And after a while, the group will come in. Well, last week you said this, and the week before you said this, and now you're saying this. And as they get to that forming, and performing stage, they'll call him on it.
Okay.
Okay. $53. Try this one, Rochelle. Got another group one.
Huh?
Try another group one.
Oh. Me?
No. So group ones,
Okay.
remember, whenever you see group, you have to think, what stage of group are they in? Okay, so that's the piece that you have to know. So some people say, I don't know, I don't even know Tuckman, formings. I don't need to know that stuff. It wasn't on the test, but it is. It just may not have those spread out. I mean, but I have to know how groups work.
So was 2 the correct? I'm sorry.
Yes, on the last
No.
one. The last one was 1.
Oh, 1. Allow the group to pick up on the discrepancy. Oh.
Okay. 53. Back to you, Rochelle.
Oh, okay. You want me to do it?
I do. Come on.
Okay.
We're gonna pass this test, girl. Come on.
Yes, we are. We are. Okay. I'm sorry. A group of adolescents is meeting in a junior high school. The group is meeting to discuss their poor school attendance, poor grades, and etc. One young woman reveals that she is being sexually abused by her father. The young woman is from a middle-class family. The group worker would. So this is a group of adolescents in a junior high school. Well, it's measuring group. This is a group of adolescents in a junior high school, and they're meeting to discuss their poor school attendance and their grades. And one of the young ladies revealed that she's being sexually abused by her father. She's from a middle-class family. And is asking what the group worker would.
Okay. So we're in it's a group, we're school, and where the group is discussed poor attendance, substance abuse, poor grades, all that good stuff. She says in the middle of group, I'm sexually abused by my father. What is the only thing that you don't discuss in group?
What's the only thing you don't?
This. I do not, if I'm going to report it, I do not discuss it in group.
Okay. The abuse.
Yeah. Okay. So then what's my answer?
1, do nothing immediately and await additional information at future group meetings. 2, speak to the girl at the end of the meeting before reporting it to the authorities. 3, speak to his or her supervisor before speaking to the young woman. 4, call the parents immediately after the meeting to advise them that a report will be made to Child Protective Agency. Well, you wouldn't have to speak to the supervisor, so you can take out 3.
When it says do nothing, that's always the wrong answer. We always
Yeah.
have to do something. Okay.
Yeah. So take out 1 and 3. Now we left with 2 and 4. Speak to the girl at the end of the meeting before reporting it to the authorities. Call the parents immediately after meeting to advise them that a report will be made to Child Protective Services. So I'm gonna do 2. Speak to the girl at the end of the meeting before reporting it to the authorities.
That's what I'm going to do. Okay. So I do not keep that in group. Okay. There's no reason everybody in group needs to know that I have to call child abuse on our parents. No, they don't need to know that. Okay. That's the only thing I can address outside of group. Everything else stays in group. Okay. So do you understand, again, the importance of when you're studying, and I say, go back and study the APGAR book and learn the stages of group. It matters what stage we're in many times, right?
Yeah.
If they're in the storming stage, what do I do as the leader? Just let it pass. Just let it pass. Storming stage is a normal part of group. Normal part. So I'm just going to sit there and usually you'll say a question, you don't know nothing about drugs. What drugs you done, Dr. Pam? You don't know nothing. Also, you might see times when they question your credentialing, right? That's often the storming stage of group. We're just really going to let it pass.
So do you
Go ahead.
Do you agree that during group, the facilitator is not the one running it, it's the group running it?
It goes from being lead, if it's a closed group, right? And I've got the same people that are coming for the next 12, 15 weeks. The goal is for it to go from being very led by me to then being led by each of the members. They all become like mini leaders. I just sit back and facilitate. Norming is when they set up the group norms. I set up the rules already, right? Don't throw a chair, we don't use curse words, we don't, whatever the rules are for the group. I set that up for group started, right? The forming stage that come in, they don't talk to anybody but me. They're all looking at me, Dr. Pam. Okay. But then as we get to the storming, they're going to fight. They're going to jockey for positions. I'll say somebody wants to talk all the time. Somebody wants to sit over here. They're going through their stuff. But at some point, the group will develop their own norms. So we know that, Mary's always late. We know that Barbara always chews chewing gum really loud. And the group hasn't said anything, so they're okay with it. That's the beginning of cohesiveness for the group. So if they don't care, I don't care. So that is really when they're norming, when they're norming and then performing, that's when the magic happens. That's when I sit back and I'm just facilitating the process. Because you know what, if sister keeps lying every week, somebody in group's gonna call sister on it. Sister, last week you said you had never been with no man, but last night I saw you. Somebody's gonna call. Right? That's what's gonna happen. So the goal is it goes from very much leader-led to then member-led. Okay. So in a good group, I could not show up and the group would still run because they're cohesive. That's where the healing happens. Okay. Okay. I love group.
I think it's
I think it's so much easier. Okay, let's go down some. I want to get some of those recall. Oh, that one is a recall. Yeah, let's do that one. 82. Mary? Let me do 81 first. 81.
You want me to do 81?
I do. Would you rather do 82? You can do both.
I'll do one. A parent expresses affection to her children through clenched teeth and denies she is angry or tense. This is best described as
Stay my question. What's happening?
A parent expresses affection to her children through clenched teeth and denies she is angry or tense.
What would that look like?
Mm-hmm.
Have a person in your life. Mary, do you have a person in your life?
Yes.
Okay. Of course I love, oh shoot, it went off. So I'm gonna try to clench my teeth and show you what it would look like. Come on. I might have just lost my camera though.
No, she is angry or tense.
Yeah. Sorry, I lost my camera there. But you know when the look on your face does not match what you're telling me?
Mm-hmm.
Okay, that's what's happening. It ain't matching.
Not matching.
Like, of course I love you. Okay, so let's rule out. What can it not be?
I don't think it's, I'm going to rule out 4.
Okay, it's not, it doesn't say, right? It's not a form of child abuse, okay?
Yeah. Mm-hmm. I'm going to rule out 1.
You're not, because you don't know what that is.
I'm thinking it's that I'm in between obsessive compulsive disorder and double bind.
So let's stick with the obsessive compulsive disorder. We went over that. Obsessive compulsive disorder means that she has to wash her hands 17 times, right? She's got rituals.
But I know it's
you see that in the question?
Yeah, no, but I know
so.
Not.
Hold on. So there's always going to be things you don't know. I will never able to teach you everything, but there's enough to know what it can't be for sure. Okay. And just because you don't know what it is, doesn't mean it's not the answer. So we know it's not 2 and we know it's not 4. Okay. So now between 1 and 3. Okay. My answer is 1. Double bind belongs to strategic family therapy. The double bind is when I'm giving you a mixed message. Okay. Now, double blind, BLIND, that belongs to research. That's when neither the person nor the researcher nor the person in the experiment knows who's getting the placebo or the real one. Severe communication disorder would be something that's like someone who stutters or someone who's, who really can't communicate.
Is that even a disorder?
It would be, yeah.
Oh, it's in the DSM?
I don't know about that, but I mean, you could probably ICD-10 code of a kid who had communication issues. Someone with autism has communication issues sometimes. Okay. So the term is double bind. Okay. And so strategic family therapy, Jay Haley, when we do our family therapy questions, he's one of those that you should know. Okay. Which test are you taking, Mary?
The LMSW.
Yeah.
I haven't came across this one, the double bind communication.
Okay. It is it's in either chapters like 6 or 7 in the APGAR book, but I also have videos. Just go whether it says NCE or social work and look for my family theories. Okay. Because strategic, structural, all those things that you need to know. And the verbiage that belongs to that double bind belongs to Jay Haley. You also talk about the paradox. That's the opposite, right? So you've got a family that you've been working with and you told them it's 17 things to do and they still haven't done it. So finally you say, fine, go home and fight for 4 hours. It's under that same category of just learning the terms. Okay. But you're going to get those. You're going to get those that you don't know. Don't freak out. Okay. Go down to 2. Always get the 2 because there's going to be 2 that you know for sure. There's always the 3 answers. There's going to be something you know for sure. Rule out what you don't know. And if you really have no idea, just go back and see if you can even match the word in the question. Okay. Simply word match. If you have no idea, don't just pick C. Somebody said that. Don't do that. Just see if you can match the word to something in the question. And then for sure, just skip it and come back. Don't answer. Skip it and come back to it because something later might trigger your memory. Okay.
So would double bind be in correlation of incongruent?
It would be, but that word, that term belongs to strategic family therapy. So you have to know the verbiage that would go to that theorist.
Okay.
Does that make sense? So when you're learning the theorists, especially my LC people, when it talks about like client-centered, right? You have to know that's Carl Rogers. And Carl Rogers said the client's and the expert, and he used unconditional positive regard. He said be empathetic. And those words belong to him. Now, all therapists can use those, but asking what therapy they're using, I know the verbiage. Okay. This is a tough one, I think. Okay. Who wants it? Thank
I'll
you,
do it.
Tiffany. Oh, go ahead, Maria.
A 10-year-old girl is referred to the school social worker because she is inattentive in class, frequently absent and late, complains of a variety of illnesses, and completes few homework assignments. Her teacher reports that the girl seems tired and
Morose.
morose.
Yeah, it's like sullen, like gray, like sad.
Okay. So sad. Okay. After 2 meetings with the girl, and I want to ask you a question about this. Okay. So after 2 meetings with the girl, the worker asks us to see both parents. Initially, the mother declines to accept an invitation to a meeting. The father agrees to meet, but is defensive while discussing an appointment over the phone, telling the social worker that the responsibility for the daughter's difficulty lies with the school. Oh, I've heard that so many times. He is known to be generally resistant to suggestions. The social worker would probably next. Okay, so we're talking about a 10-year-old girl who's referred to the social worker because she's inattentive in class, she's absent and late, and complains of a variety of illnesses and completes few homework assignments. Her teacher reports that the girl seems tired and sad, more worse. The teacher has 2 meetings with the girl. Then the social worker asks to see both parents. The mother declines. The father agrees, but he's defensive over the phone, and then telling the social worker that the daughter is basically on the school. So he is known to be generally resistant to suggestions. The social worker would probably next agree it is probably better to continue seeing the girl alone until both parents can be convinced to come. Refer the girl and the family to a family agency, hoping that they can engage the family more successfully. Call the mother to reassure her that they share an interest in helping the girl and try to encourage her to attend. See only the father and daughter. Okay, so I'm gonna take out 3.
That's my answer.
That's the answer? Oh, snap. Call the mother to reassure her that they share an interest in helping the girl. Oh, and try to encourage her to attend.
Okay, so if I hadn't said that, keep on the process. What would you have picked?
Okay. Agree it is probably better to continue seeing the girl alone. So I'm not going to see the girl alone without the parents' consent. So I can't do that.
Why not? Why not?
I mean, unless the girl gives me a scent.
She can't give me a scent in this situation. Why not? There's something in the sentence that tells me I can't see her alone. What is it? Anybody?
Her age.
Her age.
Yeah, she's
12.
10.
It'd be at least 12 from I can see you. Under
Oh,
10, I cannot see without parent permission. 12 and under is a minor. So when they tell you she's 10, that's the reason she cannot give me a scent at 10. 12 and over.
okay.
Okay. So again, I know that's that number, that stupid little thing in this big old question changes my answers.
And I thought in every state it would be different as well. That's why.
Everybody takes the same test. So for the test, it's 12 and under.
Okay. I didn't know
Everybody here lives in a different state. And I know in California, you take a laws exam. but that is not the same question as the code of ethics.
Okay.
And for this one, it's everybody 12 and under is a minor.
Okay. Good to know. Good to know. I'm glad I got that wrong.
Okay.
Good to know.
so guess, okay. So you're not the only one that didn't know that. Don't worry.
Okay.
Okay. Unless it just wouldn't have picked up on it. But the fact that she's 10 lets me know that I can't.
Okay.
Okay. Let's keep going though.
2, refer the girl and the family to a family agency, hoping that they can engage the family more successfully. That's not going to happen. If they're not going to come and see me, why would they go to an agency?
Absolutely. There's no one better than me. If I can't get them in, no one's going to get them in. I am the very best social worker. So 2 is out also. Very good. So now between 3 and 4, between the mom and the dad, going back to the question, which one of them do I have the most hope with?
The dad.
The dad says he agrees to meet, but he's defensively while discussing the appointment over the phone. He tells the school it's responsible of the daughter. The daughter's difficulty lies with the school, and he's been generally resistant to all suggestions. We got a reputation with dad.
Okay.
Okay. He's resistant. He comes in, and no matter what I say to him, he's going to say it's the school's fault.
We could change his mind, though. You never know, right?
Oh, you're thinking. It didn't say the question.
Okay. Right. Okay.
Sorry.
Yeah. Try.
So you know what? So who I could change is mom. Initially, the mom declines to accept the invitation over the phone. It doesn't give me anything else. It just says mom initially says no. I've got more hope with mom than with dad.
See, I thought calling the mother, I'd be too intrusive after she tells me. Didn't I tell you? You know.
So then what would the other answer be, though? The dad. We don't want the dad.
Right. I guess if I would have read him again, I probably would have gone with 3, hopefully. But now it's now under 12. So 3 is the answer. Call the mother to reassure her that they share an interest in helping the girl and try to encourage her to attend. Because you never know, that might change your mind, correct?
And I don't know why she didn't come up. The father already said it's your school's fault. And if the father comes in there, no matter what's going on with the kid, he's not going to listen because it's our fault at the school.
Right.
We don't want him in. Please stay home, Dad. That was a tough one. Everybody agree that was a tough one?
Yeah.
That was a tough one.
This measuring code of ethics.
This is, what would this be under?
It's under difficult.
So I'm thinking, yes, it's a code of ethics. That's one of the reasons I can't. But this is just really knowing social work practice.
So I have a question, Dr. Pam. I have issues, and I'm pretty sure my colleagues do as well, with social work in school. Sometimes I have to get the consent from the parent to talk to the social worker. Sometimes I have to get a consent to talk to the teacher. How do I know? So now I know 12 years old, I cannot have a one-on-one with a child that's younger than 12. So if the teacher comes to the social worker and says, Susie Cream Cheese is not behaving in class,
I'm just trying to find one.
Do I get the consent from the mother to speak to her first, or can I speak?
Depends on the question. It really just depends on the question. Let me see if I can find you one.
Because I'm in this group and we always have like this problem, and they ask me to ask you.
It depends on the question. It really does. So let me find, where would I find?
Because sometimes it says get the consent. Sometimes like speak to Susie. It's like,
because it depends. It really just depends on the question. That's I'm not being smart, Erica. That's really just why. Let me find. But think that's what a problem is sometimes, is we think there are these hard and fast answers for the questions, and it just doesn't work that way. It just depends on, in that particular day, in that particular atmosphere. Be fine.
Am I the only one in this group who feels that way? Does everybody else understand when to talk to the child and when not to?
I'm
Yeah,
not
I
talking
feel that
God.
way when I see a question.
Don't act like you're and those of you that who don't feel that way, share how you learn the difference.
Yeah, right.
Okay, let's try this one.
Trying to get this L and be done.
Me too.
So I'm gonna say to you, the problem is they're all different. It just depends on what situation is happening. Okay, so let me share this one with you. Screen one. Okay, so do you see number 11?
Yes.
Okay, look at that one for me.
Okay. So, okay. A social worker has started to work with a 15-year-old boy who came in feeling confused because he has started to have feelings for other boys at school. So I'm thinking he's 15. I can speak to him. Okay, but let me keep reading. The client states that his parents are very religious and would be upset if they found out he was gay. The social worker realizes after meeting with the client for a month that her own values may be interfering with her relationship with the client. Well, that took me on a twist. The most appropriate action for the social worker to take is to A, provide the client with referral to another social worker. No. Meet with the client and his parents in order to address the client's concerns. No. Continue to meet with the client. Yes. Meet with the supervisor to address the value conflict. So I'll probably do D. Okay, a social worker has started to work with a 15-year-old boy having feelings for other boys at school. The client states that his parents are very religious and would be upset if they found out he was gay. The social worker realized after meeting with the client for a month that her own values are interfering. So that's counter transference. So it's meet with the supervisor to address the value conflict, D. But so say hypothetically, it was asking about talking to the parents. The 15-year-old comes to me. So if he's already coming to me, then I can see, then obviously I can speak to him, correct?
Exactly.
But if
Exactly.
referred him, if the teacher referred the 15 to me, can I see him without
I sure
getting
can. I sure can.
Okay.
I sure can. I sure can. The question I'm looking for is the question that talks about you've got this 8 or 9-year-old, and the teacher gives you a referral for the 8 or 9-year-old because she's bullying. And the you go to the parents, and the parents, the mother says, "No, not my kid." And what do you do next?
I say, yes, it is your kid. No, I was playing. If I go to the parent and the parent denies, the child is bullying, and I go to the parent and the parent's in denial about it.
Oh, that's judgment.
I can't.
Oh, that is such judgment, though. How do you know that the kid is bullying just because the
Oh,
teacher said so?
I'm gonna go and observe.
Okay, the question doesn't say that, though. The question just says the teacher reports that this 8-year-old is bullying. You're bringing your job into it.
You would, when you talk, well, no. The
You tell me, what would I
child
do?
is
The child is 8. So the teacher said, I'm looking for that question. The teacher says, you get a referral. The teacher says, little Bobby over here, he's a monster, and he's always doing this stuff at school. He's awful. The other kids are afraid of him. And you go to mom. Hey, teacher, teacher said, hey, I think that, the school said little Bobby is doing this. And little Bobby says, what are you talking about? What do you do next?
I would observe.
That's not an option.
Oh, what's the option then?
I would either, the answer is go back to the referral source.
The teacher.
Go back to the
and talk
teacher.
to the teacher.
I'm not going to ask Bobby. If I ask Bobby if he was bullying, what's he going to say?
No.
Not me, Miss Pam, not me.
Right.
Okay, so that's what I'm saying. Every question is different. I'm gonna try to pick up a couple that are still with a kid, okay? And somebody else can do this one, and someone else you can. Does anyone see? Am I sharing 54?
Yes.
Mm-hmm.
Someone who hasn't seen this one.
Oh, I haven't seen it.
Anybody else want to turn?
I ain't seen it either. But...
Yeah, I don't think I've seen it.
Okay, go ahead. Tiffany, go ahead. I'm going to put just a couple of those just so you see how to answer. It depends on what they're asking me. Go ahead.
A school social worker meets with a 6th grade teacher regarding a student who was recently diagnosed with type 1 diabetes. The teacher reports that the student has isolated herself from the other students, has fallen behind, and isn't interested in participating in class like she used to be. The social worker should first, okay.
Stand my question.
Okay. So you have a 6th grader. Teacher, okay. A 6th grader who was referred, looks like, by the teacher and was diagnosed recently with type 1 diabetes. The student has been isolating herself from other students, hasn't been doing as well in her classes, and isn't participating in class. Okay, so what should we do first? A, meet with the student and explore her feelings about receiving the diagnosis. B, contact the student's parents to obtain additional information. C, help the teacher understand the effects of being diagnosed with a long-term illness during this critical stage of identity development. D, refer the student to a support group. Okay,
what would
so
I rule out?
C and D.
C and B or C and D?
C and D.
C and D. Okay, now you're between A and B. What should I do first?
Okay.
Go back to the question when you're not sure. Go ahead, carry the two and go back to the question.
Okay. Who was recently diagnosed with type 1 diabetes. Okay. I would contact the parents first, just to see if some of the same things are happening at home as well.
Well, I probably
and
wouldn't.
other things.
I would call them. I would call them. That's my answer, but not to see what's going on. I'd call them because, I'm sorry, in your school, did you learn about type 1 diabetes? Is that your college taught
that? No.
Okay, because my college didn't teach that. So I mean, I don't.
Are you talking, Dr. Pam?
Am I muted?
Yeah.
Okay, I am talking. Can you hear me?
Yes.
Yeah. Okay. Yes, I'm talking. Yes, I'm sorry. Yes, I'm talking. Okay. So I said, what did your school teach you about type 1 diabetes? What in your medical social work program? Where'd you learn that?
None.
Oh, anybody else's? Did y'all go to medical MSW school?
No.
Okay. So I do not know what's going on at home. I don't know enough about diabetes to know. She's isolated. She's falling apart. I don't know. That's why I'm going to the teacher. Why is 2 not the answer? I'm sorry. Hold on. 2 is the answer, not 1. Why is 1 not the answer?
I would suspect the child may not know how to explain, because they'll explain to her, and mostly they've explained his diagnosis to his parents, and he may not be at a position of explaining to us better
Where do you see explain? I said,
Well,
why is A not the answer?
Because it's a sixth grader.
What does
'Cause you're-
A say?
Oh, so what do you think about your
Explore.
diagnosis?
Meet with the student and explore their feelings.
Mm-hmm.
Do you see
Mhm.
anywhere in the question where the 6-year-old says they have feelings?
Nothing in
about
the
this?
STEM is about the feelings.
No,
Then my answer can't be feelings.
that's right.
Okay.
That's right.
If my question has feelings, then I address the feelings. But does a 6-year-old say he's upset? Are they they're boohooing? They're lost? Does it say in that anyway?
No.
Mm-mm.
All I want to know, the teacher asked me, is this normal? Is this what you is? I don't know what it's supposed to be like. I didn't go to school for diabetes. What? Make sense?
Mhm.
Hard question?
Yes.
Typical question?
Yes.
Okay. In this situation, of course, I'm going to go to the parents because I don't, that's out of my wheelhouse. Okay. Remember, we talked about, the planning, the steps, the social work problem solving method. I can only address feelings if the question addressed feelings. If they're upset, if they're angry, if she's boohooing, then I'm definitely going to talk to her about how she feels. But that's not what the question asked me. The teacher asked me, right? Is this part of type 1 diabetes? And even if you do know the answer, most social workers don't. Okay, now she's an adult here, but let's look at this one. If you've seen it, don't answer. Who's taking it?
Let me try.
Okay.
During a therapy session, an 18-year-old client reports that he assaulted his neighbor's son because he suspected the son broke into the client's.
Hold on. That's the wrong question for that answer. No, the answers don't match that question. Hold on. I'm sorry. Wait. There we go.
Yeah, it's different.
Yeah, sorry. There we go. There we go.
Okay.
There's a D there. I lost a D.
During a therapy session, an 18-year-old client reports that he assaulted his neighbor's son because he suspected the son broke into the client's car and stole his radio. How should the social worker proceed? So I'm a therapist. There's an 18-year-old who assaulted the neighbor, and the reason is because he claimed that the child broke into his car. And they're asking how would the social worker proceed? They say A, file a child abuse case. B, determine the age of the victim. C, maintain confidentiality. Okay, I will not maintain confidentiality because I don't know the degree of assault. So I will eliminate C. Then between filing a child.
Who's my client? Who's my client in this one?
Is the 18-year-old.
Okay.
And he said he assaulted. So I don't know the degree. I mean, I don't know.
Mm-hmm.
So that's what I'm saying. Like I wouldn't keep confidentiality. So I'm eliminating that one. Then between file a child abuse or determine the age of the child. I think the age of the child is not known. So I can't file an abuse without knowing. The child could be 18. They could be the same age mates, which are already adults. So I think I'll determine the age, then I will file for. So I would think I'll do B.
Are you suggesting you would assess first?
Yes, determine the
That's your
child's, yes,
assess answer. That's your
correct.
assess answer. That's what we do. We assess first.
Yes.
It really depends on, right? If he were like 20, it'd be a different story. But you know what? If he's 6, it depends on. So that's my assess answer. So I couldn't determine safety in this one first. So I assess before I do anything else. Okay. Trying to see if I can find some more questions. I was looking for you. Okay. 62. Anybody? Margot, I'll come across some more of those.
Thank you.
What's this one? 62.
A social worker sees a 75-year-old Asian American man whose wife died 6 months ago. In the intake interview, the client reports that he has lost weight, has very little energy, and has difficulty getting himself to do things. What should the social worker do first? So, a social worker sees a 75-year-old Asian American man whose wife died 6 months ago. So, it's at the beginning, it's an intake. The client reports that he has lost weight, has very little energy, and has difficulty getting himself to do things. So, okay, what should the social worker do first? Complete a suicide risk assessment of the client. That's probably all I would do, but I don't see hopelessness or helplessness. Explore available family and community resources. Suggest the client schedule an appointment with his doctor. Refer the client to a local bereavement group. So I'm not gonna do D. I'm not gonna just say you need to go see a local bereavement group. He might not in life, but I'm not gonna do that's not gonna be the first thing. Suggest the client schedule an appointment with his doctor. Well, he's 75. His wife died 6 months ago. He has lost weight and he has very little energy in getting himself to do things. Explore available family and community resources. It doesn't talk about any of that.
If it's an old man and he lost his wife, his spouse, his job, men don't live very long without their spouse. Right. Old man, always assess for suicide.
Okay. So that's what's going to be my number one, but I was discussion of helpless. Okay. So
because he's an old man.
Okay.
He's an old man. So whenever you see it.
So old people.
Oh, men, old men.
Oh,
do you know that's the highest rate of suicide in the country?
Men.
Well, white old men. So it's really
85?
white. The high. Would you say, Mary?
Is the age around 85?
Actually, I've seen a question. It was 45. So 45? The things what we're looking for is a man that feels like he has nothing. He lost his job. He lost his house. There's one question that says he can't send his family to see him this way. So that's knowing that men at that age are more likely to kill themselves. That's the highest rate of suicide. And professionals like doctors and lawyers, that's also a very high rate of suicide. So they have always identified themselves either as the spouse or the wife, and now they're lost. Very high rate of suicide. So the key to that one, I know it was Asian, and I usually say if they're Asian, make sure I put something in the question that talks about a culture, but none of these talk about culture at all. So then I just had to go with the fact that he was a 75-year-old male.
Yeah.
Okay.
I was to choose A, but I just want to go through everything.
I know. And you said there wasn't hopelessness there, but what I want you to notice is whenever I see that old, and he's not white, but old men, old women, it's not the same answer. Give us a couple of years, we'll dust ourselves off and we'll be fine.
Right.
Okay. Those are human behavior facts, right? How many women, how many men are in nursing homes? There's like 1 in 20,000 women.
That's good to know, old men.
Let me go back to my other. But that's what I wanted to just show you is it really depends on the question. Okay. I can't say it's always this way or always that way, but read the question. Try that one. Let's try that one. Who has had a turn recently? Sister, you want to? Oh, who's that? Zoe?
Chloe.
Go ahead.
All right, it says
Are you
a
out
foster mother-
gallivanting?
No, I'm not driving. I'm
I
just
said, are you
out riding.
gallivanting? I didn't say driving. Are you out gallivanting? I'm not sure what that really means, but gallivanting, up to no good.
Yeah, I am up to no good.
Okay,
Good job.
Add that to your vocabulary. Gallivanting.
It says a foster mother is terminally ill. Though the family is very upset, they seem to be dealing with the situation quite well. Her husband does not wish to. A 7-year-old foster child has been in the home for 5 years and is deeply connected to the family. The father and the older children want to continue caring for the foster child, and they are capable to do so. In this situation, the social worker should. So, you have a foster mother who's ill. They have a kid that was in foster care since they were like 5. They want to keep the child. So that's what it's asking me. You should remove the child from the home immediately. Explain to the father that the child may remain only if the mother can care for the child. Allow the family to continue to care for the child, or explain to the father that the child can remain if he informs the wife of her illness. So I would eliminate
Go back to my
one.
question. Go back to my question. What are they trying to measure in this question?
They are trying to measure. I don't know. Code of ethics.
So
No.
are foster care kids supposed to stay with me forever?
No.
Right? The goal is that they stay with us for a little bit. We TPR them, they go up for adoption. That's the goal of foster care. Okay. So that's what they're trying to measure is, do you know that, hey, you know, it ain't their real kid. Let's just go ahead and pull the kid back. Or is there something in the question that says, no, let's let the kid stay with the family? So that's what they're measuring.
So then I would I remove the child from the home immediately? No. Maybe we'll keep that. Explain to the father that the child may remain only if the mother can care for the child. I would eliminate 2.
Okay. How old is the kid?
7.
And how long has he been in the foster home?
5 years. So he's been
Has
there
he
a while.
ever known anybody else as a family? Probably. He's 2. He was 2. He didn't remember anybody. Right. So in his eyes, this is his family.
So
that's what matters.
So the answer should be 3, right?
Absolutely.
Yeah, that's what I was going to do.
Absolutely. Okay. If it said he'd only been there, you know, he was 7 and he'd been there 2 months, it would be a different answer. But because he's been there for 5 years, right? And he is deeply connected to the family. So can you imagine the double loss of the mother dying and then putting him in a foster home, that poor little kid? Okay, so that's what they're measuring in this question, that we know that kids, we do not want kids to linger in foster care. We want to terminate parental rights, free them up for adoption. We don't want kids in foster care any more than 18 months. That's the law in most states. Does it happen? But for the test, that's what it's supposed to look like. And the younger babies are, the faster we want them out of foster care. We do not want babies in 16, 17 different foster homes. Anybody CPS or has worked for CPS?
Yes, I have worked for CPS.
And did you find that worked out well, right? That just kids Just parents terminated their rights and it worked out really great for everybody.
No.
Okay. Okay, again, we're just learning that it's a reading question. When they put things in there, they put it in there for a reason. Okay. Mary? You're muted.
Which one? 101 or 102?
101.
Okay. A boy of 16, arithmetic from early childhood, is under the care of a special clinic in the hospital outpatient department. He is well known to the social worker in this clinic. One of the needs as the social worker sees it is more, varied social contacts, which are difficult for him because of his very limited mobility. His widowed mother is overprotective. The boy has shown an interest in music. The social worker might suggest that he go to a
Stay on my question. Stay on my question first.
The boy has shown interest in music. His widowed mother is overprotective. The boy has shown interest in music. The social worker might suggest that he go to a
Let's rule out. He's 16, arthritic from childhood, under the care of a special clinic that he's outpatient, right? He is well known to the worker of the clinic. One of his needs, the social worker sees, is more varied. He needs to hang out with more people, but it's difficult because of his arthritis. That's right. So he's got a very limited mobility. His widowed mother is very overprotective. The boy is very interested in music. The social worker might suggest he go where? Okay. I can tell you she is not sending him into a boarding school.
Yeah, I was going to rule out 2.
Okay, 2 is out. She's not doing that.
Rule out 2.
Okay.
Social clinic in the hospital. I would rule out 3.
Why? What words in the question tell me I should rule out 3? Because what I want him to get is more varied social contacts.
Oh,
a
yeah.
private teacher won't get him to meet anybody else, will it?
Yeah. No, it won't.
Okay. And when I say why, it always just means go back to the question. Go back to the question. How do I know that? Okay. So now you're between 1 and 4.
1 and 4. Very limited mobility. People has shown interest in music. The social worker might suggest that he go to a
and don't use your we can't afford that stuff. Don't use that social work hat, okay? And so social work test, all things are possible, okay? But what I'm looking for is it'll help him get interested in music. He'll be safe, right? And he'll also get to meet more people.
I would say a community, the number 1.
You would? That's
I don't even music class, either one. I'm torn.
The answer is 1. Okay. The answer is 1.
Yeah, community center, I guess, so he can socialize.
Exactly. I don't imagine, and I can. My son had cancer, and we were in the hospital a lot. But the other, he was 19, and the other teenagers in that unit was so small. I mean, it would depend on week to week when we're going for chemo or back, but not enough to build like any kind of environment with people. Margo, you got that look on your face and you're muted.
Why wouldn't it be 4? Music class in the hospital?
So how would he get more varied social contacts?
Well, isn't there other children in the hospital that are seeking the classes?
But
How
he's
often do you stay in?
outpatient, right?
He is outpatient. And how often do you stay in the hospital? How long do you stay?
Well, they want you in and out.
Mm-hmm.
It's an outpatient department, but he goes there often. They all know him. And if
They do.
in the hospital, you know, kill two birds with one stone. I got to see, go to the doctor and then you go to class.
One is the best answer.
Okay.
Okay. And if it said he was inpatient, that would have been okay.
Okay.
So
So
when I go
because
out of my way to mention outpatient, that gives me the clue that he's not there. He's right.
okay. Yeah, I would have got that wrong.
So what I'm trying to just show you in this whole lesson is how those stupid little words matter.
Yeah, I know.
And you think, oh my God, you go so great on this test, or you fly through them and you have so much time left. It's because you didn't spend the time. Okay. It's really a matter of just knowing what they're asking me.
Yeah.
Okay. A sister? What, 99? Sister, hold on to that one. You're talking about LC. Go to number 98.
Okay. A wife and husband are in an initial intake session with a social worker. The husband is significantly depressed and asks for individual treatment. As the interview progresses, the wife defines marital issues, describes her husband's feelings and behaviors, and smiles when she says something with which she agrees. When the latter occurs, the husband smiles in return. A major issue for this couple will probably involve husband and wife for an initial intake session with a social worker. The husband is depressed and he wants individual therapy. In the interview progresses, the wife defines some issues that they are having within their marital issues, such as the husband's feelings and behaviors. And each time she says this something, he will agree. In the later occasions, the husband smiles in return as well. So they're asking what major issue for this couple will probably involve
When the latter occurs, what does that mean? Everybody know what that means?
At the end of it, like after everything.
So the latter means what happens last. So when the last thing happens, when the wife smiles, when the describes the husband's feelings and smiles, and then when the latter happens, the wife talks, the husband also smiles. Okay, if you know your Bible in latter days, that's what that comes. Just so you know. Increase your vocabulary, guys. Increase your vocabulary. That's how I know the word. That's all.
Yeah. So they say one, depression, marital relation, enmeshment, or paranoia.
Let's rule out.
I'll roll out.
Is this normal?
No.
The husband is significantly depressed. He comes in for treatment, and every time he talks about his feelings, and so the wife describes the marital issues, talks about her husband's feelings and him being depressed. He smiles, and then when he talks, but they're depressed. Something's wrong here.
Okay, I will eliminate 2 marital relationships, and I'll also eliminate 4 paranoia.
Okay.
Between enmeshment and depression, I think, okay, the depression, since there are 2 of them there and the dynamic is between both of them, depression just goes with the husband, but enmeshment, there's lack of boundaries between 2 of them. So I think 3 will surely cover both.
Absolutely. Very good. Structural or strategic family therapy? Which one?
Strategic.
Structural, enmeshed, structural, boundaries, hierarchies. That's structural, right? My house is built on a firm structure, clear boundaries, right? When everybody's in everybody's business, you're enmeshed. When you don't have your own thoughts and feelings of your own, right? She and her husband have the same thoughts and feelings, they're enmeshed. That's unhealthy. If it's a genogram and you got the same stuff from your great grandparents and grandparents and your parents, it's called fusion. It just means the same thing, but Bowen genogram called it fusion. You're like nasty just together, right? Again, that's knowing the verbiage from knowing that's a strategic structural family therapy.
What was that answer?
3 was enmeshment, and it belongs to Mnuchin. Mnuchin is a structural family therapy. He's the one that joined your family. Okay, let's do one more round, everybody. Rochelle?
Okay. I'm doing 97.
Please.
Okay. A social worker interviews a couple for the first time. They have lived together for 7 years and have decided to marry. A wedding will take place in 4 weeks. Arguments have now arisen over money, cooking arrangements, Mr. Brown's spending habits, and Mrs. Smith's coldness and interest in cultural television programs. They begin the interview feeling they should cancel the wedding. The social worker would. So in this question stem, I'm interviewing a couple for the first time. They've been together for 7 years. They're getting ready to get married. They will get married in 4 weeks. Now they're arguing over money, cooking arrangements, Mr. Brown's spending habits, and Mrs. Smith's coldness and interest in cultural television programs. They begin the interview. After all this happened in the interview, they're feeling like they should cancel their wedding. So that's what's going on in the question. Number 1, refer the couple to a clergyman.
Clergyman, a priest, a pastor.
Yeah. 2, suggest individual treatment since the issues seem deeply embedded in their character. Number 3, suggest that the wedding be temporarily postponed. 4, clarify the disagreements and consider the possibilities that the new concerns may reflect anxiety about the wedding. Let's see. You're not gonna refer them to their pastor. Well, we're not gonna refer them to a pastor.
So it doesn't say first, but my mind is going, what would I do first? What would I do first? Right? That's my mind. No matter what the question says, I'm thinking, what would I do first?
Okay. But
when it's a vignette.
Refer them. Okay, so we're not gonna refer them to the pastor. We're not gonna do 3 either. Suggest that the wedding be temporarily postponed. So we left with 2 and 4.
Okay.
Wait a minute, let me go back to the question. Gonna go with 4. Clarify the disagreements and consider the possibility that the new concerns may reflect anxiety about the wedding.
That is true. Now tell me why. What words prove it to me? Or what words tell me that 2 is not the right answer?
2 is not the right answer because they're arguing over money, cooking, Mr. Brown's spending habits, and Mrs. Smith's coldness and interest in cultural television programs.
Okay, so suggest individual treatment since the issues seem deeply embedded in their character. That is not right. Do you know how I know that's not right? There's a words or sentence in the question that tells me that they don't have these long, deep-seated issues. Do you know why? Anybody? Tiffany, I saw your lips move.
Well, it looks like it says that they've been living together for 7 years and it's
absolutely, absolutely. For 7 years, things were fine. So that's why it's a 4, right? It's nothing. It can't be something deep embedded in their character. You would have picked it up 6 years ago.
Yeah.
Okay. So when you get down to the 2, that's where you're always trying to go back to the question. So I'm either trying to prove it's either right or wrong based on the question. And again, they don't mention that to me just for the heck of it. When they tell me they've been together for 7 years, that means something. That means something in the question. Okay. I know most people like the shorter ones. I like the younger vignettes because it gives me more to work with. Right? If I go back and reread, it gives me just so much more information to work with. Okay. 94, Margo.
An administrator wants timely, complete, and more relevant information to help improve services, allow for more effective decision-making, and promote wider participation in the development of information used in decision-making. The best first step to stimulate this process is to, 1, evaluate the success of the present problem. 2, establish standing committee. 3, call in a consultant. 4, involve the board of directors.
Okay, so go back to the question, because this is oh my gosh, it's community, it's indirect practice. So go back to the question, see what they're asking me.
That's what I was gonna say. This is my another weakness.
No, okay. No. These are just areas that you just can't wait to learn more about. That's all.
Yeah. Okay. An administrator wants timely, complete, and more relevant information to help improve services, allow for more effective decision-making, and promote wider participation in the development of information used in decision-making. The first step to stimulate this process is to evaluate the success of the present program. So there's no present program.
Where did it say that?
No, I'm saying there's no evaluate the success of the present program.
I mean, so he's doing something. There's got to be a program. He's an administrator, right? So there's got to be a program.
No, I misunderstood. Okay. So I like 1 so far.
Okay.
Establish a standing committee. So I want timely, complete, and more relevant information to help improve services. I don't need a committee for that. I don't think so. Call in a consultant. Timely, complete, and more relevant information to help improve services, allow for more effective decision-making, and promote wider participation, development information using. Do I call it?
So I don't think you understand the question yet. Go back. I think you're missing something. What's happening in the question? I'm the administrator, right? And I want to improve services. We need to improve these services. They need to be more on time. They need to be more important, relevant. We need to get these services out there. I need to allow for effective decision-making, right? And my clients, how they make decisions effectively, and promote wider participation in development of the programs in the decision-making process. So what I want is to come up with this program to really help, it's always about my clients, to help my clients be able to get more information as quickly as possible, to help them make effective decisions, and even at the agency, promote the fact that we really want you to make your own decisions. So that's what I want to do. And no matter what kind of question it is, if it's a vignette, I still follow the social work problem solving process, which means I first assess. Is there any information I can gather before I make any intervention?
So I'm going to evaluate.
What's my answer?
Evaluate the success of the present program.
Absolutely.
Would I also call a consultant?
Not first.
Right. Okay.
Not first. Okay. So okay. First, why reinvent the wheel? If it ain't broken, then we'll need to fix it, right? So let me go back to what we're doing currently and see what's not working. So first, I would look at my current program. That might also be referred to as a formative. If I formed a program, right? And we're trying to see if it's working or not, that'd be a formative evaluation. And the summative would be the end, the summary.
Right.
You all knew that, right? Mary's like, Dr. Pam, I knew that.
And didn't know it in this. Yeah.
Okay. So formative is while it's forming, and second is the summative is at the end. Okay. I've never liked that question. '96. Sister?
A hearing impaired child was being taught to speak in a residential treatment center. Each time the child made a sound, he was given a chocolate candy and a smile. When no sound emerged, nothing was given or said. This is an example of, there's a child who has problem with impaired hearing, and he's there for residential treatment. So each time there's a progress, the child is being rewarded. And when there is nothing, when there is no sound, nothing is given to him. So they're asking like, what type of, this is an example of what? Vicious reinforcement, positive reinforcement, differential conditioning, or shaping. Okay, I'll eliminate shaping. It's not shaping. They're not shaping.
Yes, you are. That's the answer.
But I'm giving her something.
What do I want the kid to do?
To be able to talk. I thought it was a positive reinforcement. Sorry.
Okay, but hold on. I want him to talk. Has he talked yet?
No.
What did he do?
Sometimes he does, sometimes he doesn't.
But whenever he makes a sound, it doesn't say he talks. Whenever he makes a sound, I reward him. I'm trying to get him closer to talking.
Okay.
Okay. Oh. I know. If shaping wasn't there, positive reinforcement would be it.
Okay, because I was saying positive reinforcement.
But if shaping is there, shaping is what we do, reward you to get to where we want you to be.
Correct.
Okay. So when little kid first takes his first step, we go, yeah, good. Do we want him to stop there?
Okay.
We keep clapping because we want him to keep walking. So shaping is when I haven't gotten there yet. I'm making improvement. So I'm going to reward you as you get closer, but you haven't gotten there yet.
Okay, so to reiterate, because I was also agreeing with her, I'm sure everybody was. So positive reinforcement is when we already got there and the clients already learned.
What I like what they did. I like the behavior, and I'm rewarding them for the behavior that they did.
Right.
The difference in this question is he hasn't done what I want him to do. What does the first line say?
He's hearing impaired. And each time he made a sound.
Read that first line.
Oh, a child impaired was being taught to speak in.
There we go. And what I want him to do is to speak.
Okay.
He hasn't spoken yet. He's just made sounds.
Okay. So Dr. Pam, it makes a difference now because reinforcement is a habit that you've seen and you want to reinforce that habit to continue. In this case, the child is not speaking. So, okay, now I got it.
I want him to speak. I'm happy with what he did. I'm yay praising him. Hey, great job. But he didn't get to where I wanted him to get yet.
Correct.
Okay.
It's a tough one.
Know.
Would be continuing to want him to do what you're teaching him.
I want him to speak.
Okay.
I want him to speak. Did I mention it was a reading test?
Yeah. You said that so many times, more than 100. Thank you.
because it's that important. Because most of you didn't even read the question. You saw it doing good. Oh, it's positive reinforcement, and left it at that, and you didn't read anything else. And even if when you took out shaping, you didn't give it a thought. You just knew what the answer was. And then, like, Dr. Pam, I had shaping, I had behavior reinforcement, and I knew it, and I don't know why I failed. Okay, I'm not making fun of any of you. I'm just saying this is what happened. Okay?
That's exactly what we doing. That's exactly what
I'm trying to teach you the importance of it being a reading test. When they put those words in there for a reason. And I know that one of the programs says that they're distractors. That's not true. Everything in there matters. Everything in that question matters. They're giving you all these red flags and clues. It's like, you know, the airplane guy who got the airplane in, the question's going, look, look, look. Okay, they're putting it in there for a reason.
Oh, yeah.
I know. You'll watch this video 17 times.
Girl.
Okay. Tiffany, have you seen this one? 90? Tiffany's like, that's long.
Think so.
I ain't taking that one.
I don't think so. I don't think so.
Okay.
Is this a good LC question?
No.
No.
Nope.
Hey,
who's
them
doing LM?
they're hard too.
Yeah, but they're more clinical. Who's doing LM? Who wants this one?
I'll do it.
Thank you.
A
Thank you.
4-month
I've sent it, Tiffany.
A 4-month-old baby born with several drug withdrawal symptoms and recently abandoned by her drug addict mother is to be placed in a new foster home. In this situation, the social worker should drug withdrawal symptoms and recently abandoned by her drug addict mother. In this situation, the social worker should, 1, not tell the prospective foster parents about the natural mother's drug addiction, so they will not become too worried or refuse to care for the child. 2, tell the prospective foster parents about the natural mother's drug addiction, but reassure them that they will have no unexpected difficulties. 3, inform the prospective foster parents of the child's background and explain that she may have medical difficulties or developmental problems and that the agency will assist them when necessary. 4, not tell the prospective foster parents about the child's background unless they ask.
In the real world, people do 4, but we're taking that one out.
Yeah,
In the real world, 4 is what happens. You drop that baby off and hope they never call you back. That's not the right answer.
About the child, yeah. So 4 is not it. I would rule out 4. I would also rule out 7. I would rule out 2.
Right. I can't reassure them of that, can I?
Yeah, you can't.
Okay.
I'm too worried or refuse to care. I would also rule out 1.
So what am I down to?
3.
Okay.
Inform the prospective foster parents of the child background. Explain that she may have medical difficulties or developmental problems and that the agency will assist them when necessary.
Very good. Not true either, but the right answer for the test. $80, Tiffany.
Okay. Most schizophrenic disorders usually have one or more of the following characteristics, except 1, flat affect. That can be true. 2, delusions or hallucinations. That also can be true. 3, poor sense of time and loose associations. Or 4, the ability to concentrate on detailed conceptual work.
When it's an except question, 3 they will have. So I would start with the 3 they will have.
Yeah. 1 and 2. And yeah, I would say also 3.
So my answer is
4.
absolutely, absolutely. They just can't. So if you see a question about schizophrenics in a support group, it's short, short specific task, but very short, right? Put the paper in the paper holder, very short, because they can't stay focused for a very long time. So let's diagnose. Brief psychotic disorder is how long? When did it start?
3 to 30 days.
Got it. Schizophrenia form is
1 to 6 months.
and then full-blown schizophrenia happens after
6 months.
6 months.
6 months.
upward.
What are the positive and negative symptoms of schizophrenia? Positive is not good. There are things that are added and things that they're missing.
Hallucinations.
Is positive or
Dis-
negative?
Positive.
Got it.
Got it.
Hallucinations, delusions, things that they're not supposed to have. Remember, positive is not good. It's added. Negative, what they're missing is they're missing, they have sometimes what is called abolition. They just don't want to get up and do anything. They just have no energy. Okay, so positive and negative symptoms of schizophrenia. Seems too easy. I'll wrap you up, guys. Did everybody get a turn? There's one I wanted to answer. I wanted to pull up. 16. Take that one too, Tiffany. I'm sorry, 87 and 16-year-old.
Okay. A 16-year-old boy worries about undressing in the locker room. The boy has no genital or underarm hair and believes his genitals are underdeveloped. The adolescent is referred to the school social worker. As a first step, the social worker would 1, encourage the boy not to be ashamed. 2, suggest that he might see a physician specializing in this problem. 3, refer the family to a family agency. 4, discuss the matter with the physical education teacher.
Say my question.
Okay.
What's it asking me?
Okay, so he has worries about.
Is this normal 16-year-old human development?
No.
Got it.
Okay. So I would exclude 3.
Okay.
I would exclude 4.
Okay. Now between 1 and 2.
Okay.
Go
So
back to the question.
okay, he has worries about this issue. Okay. It may be medical, so I would say 2.
You would. Very good. If the question said he was embarrassed, I would pick 1 first. Because his feelings, I would address with feelings, but he doesn't have any feelings of it. He just says he's worried about dressing. If he says they make fun of me and blah, 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 then I would address feelings, but there's no feelings in the question. It is just human behavior, and something's not right here. Very good. Very good. Very good. Okay. I put a question in the chat box that Margot, you had asked about earlier. That's usually one with the siblings there. For my LCs, I'm just going to go and let's pick up some just recall, especially when it comes to therapy and diagnosis.
Quick.
The LPC, it's the licensed professional counselor. It's just because this one is always been
Get
much
your
more
finger
common.
out there. Stop biting on yourself.
For Rochelle, y'all saw her, right? We should call that in. She was biting on her baby. We heard that, Rochelle.
Oh,
Okay. Somebody take this one for me. Be brave.
Is this an LC?
This is an LC question.
Okay.
I got you, Dr. Pam. The best definition of a differential diagnosis. So it's
You know what
asking
it
what's the
means?
best for like the Z codes and like you don't have all the information. Make a
That can be it. I
diagnosis.
don't have all the information. Also, so a differential diagnosis is usually there's a couple of things that make them different. So if I'm not really sure which diagnosis it is, sometimes I'll have to do a differential diagnosis because they look very similar. Okay, so we know that ODD and conduct disorder look very similar, right? But I'll go down to the list to then determine which one it is. So that's doing a differential diagnosis. Okay, so go ahead.
It says A, diagnosis that is presented at the end of an episode of care. B, a second diagnosis that is in the same diagnostic category as the first. C, a diagnosis arrived at from a clinical presentation that could indicate more than one diagnosis, or a diagnosis that is different from the primary diagnosis of the client. So I would eliminate A and D, so it's between B and C. A second diagnosis that is the same in the same diagnostic category, or a diagnosis. It's C, right?
Ding a ding a ding a. Good with that?
Yeah.
This is probably on both tests, but EMDR. EMDR is that rapid eye movement. You're supposed to bring up the painful experience, right? You bring it here on your chest. And what I want you to do is follow my finger with your eyes. And the goal is that I cannot do both. I'm trying to trick my body, trick my brain into diffusing the pain. So think about the worst incident, the worst time you've ever had. And then at the same time, while you're thinking about that, follow my eyes. Show what it looks like. Okay. So it's used for PTSD, any kind of traumatic event. I bring up the traumatic event. I think about it in detail, keep thinking about it. And it's always like the goal is like, it's your heart, it's heavy here, or your ego, having one talked about it, right? And then while you keep thinking about that, I need you to eyes, just focus my eyes. So you're trying to do both at the same time. And the goal is eventually it'll trick your brain because your brain can't do this and focus on this. Did I send it on the test? I've seen it in study material. Seen it on the test? I see some notes. I've seen it in the LCSW study material. So a person who's a good candidate for EMDR is something with the traumatic past. It's the treatment for PTSD. Okay. Acute stress disorder is how long?
30.
3 to 30. Absolutely. On the 31st day, it becomes PTSD. Perfect. Okay. This is a parenting question. This could belong to anybody. John is a parent who believes the best approach is to be close friends with his children and to behave like an equal. Generally, John does not discipline his children and never tells them no. Which of the following outcomes would likely to be for a child from this household? What parenting style is this? This is what they're asking you. Tiffany, you're taking notes. Would you like me to put these questions in the chat box? Nope. Okay, well then. What parenting style is this one? His best approach is to be close friends.
No, permissive.
Permissive, absolutely.
Qualitative?
That's permissive. I
Oh,
want to be your buddies. I
qualitative?
want to hang out with you, right?
Oh,
Right.
So the authoritarian is the worst. That's the one I'll tell you exactly what to do, how to do. Authoritative
Right.
is the best. There's permissive and there's uninvolved. Uninvolved is the worst.
Yes.
Okay. So it doesn't say anywhere, but that's one of those bomb-ridden. I don't know. Somebody knows what chapter she's in, either one of the books. That's who it's asking about. And I'll say, did you have any of those questions on authoritative parenting? Okay. Actually, I think it's in chapter 1. Okay. So then I know if he has permissive parenting style, what can I expect? Anybody?
B.
Ding, ding, ding. I'm used to getting what I want when I want it. You know this one. A social worker is conducting a diagnostic session with the family and wants to learn about the family dynamics, unspoken rules, and communication patterns. Which are the best tool for the counselor to use? So it's my first session, and I'm trying to learn more about the family dynamics, the unspoken rules, the communication patterns in the family. What can I rule out for sure?
Eco map.
D.
You can rule out open.
I can rule out open system, right? That's so open and closed systems, right? So we don't want an open system. We want a healthy system. And did I rule out EcoMap?
Yes.
Because?
No, eco map is your answer.
Because?
It gives it shows how they relate.
Does it show how they're linked outside the family? EcoMap is your ecological system. It's not just inside the family, is it?
It's like the support system, right? Like
Yeah.
churches.
So it's like it's like all those mean things that your mean teacher made you do, right? You're looking at all the things, whether it's micro, meso, right? All the things that are actually outside of the system. Systems
Correct.
theory says everything is interrelated.
Correct.
Dr.
It's
Pam,
program.
class on research and communities and all that.
We have 2 separate ones. We have one on research, definitely, and we have one on indirect practice, both of indirect questions. Okay, do you see that one, my EcoMap?
Yes.
Okay, so that doesn't tell me just about family though, does it?
No.
Okay,
Talk
that's
about
Bronfman
work,
Brimmer's.
college, yes, church.
Okay, got it. So that's your ecological system. So that can't be right because the question doesn't ask me just about that. It asks me about the family. So that's the only thing that talks about the family. Now, it would have been easier if they had said multi-generational. Then I definitely would have known that was Bowen, but it didn't. I got 4 choices. Make sense? My LCs, have you seen narrative therapy?
Yeah, it was on the test.
I
You know
didn't
what
see
it is? It's
Is it-
usually on there, and most of the time people don't know what it is. Okay.
Was it
Narrative therapy is the story I tell myself. I've got like a CD, like a cassette player, right? And you remember, way back then, the cassettes. I know if you're not old enough to get out of my group. Okay. So I've got this tape playing in my head over and over and over again. Everybody has a different tape. Okay. My tape growing up, I'm 58. My tape said, you can't be smart and be pretty. That if you're smart, people will think that you're dumb. And if you're pretty, people will think that you're dumb. I mean, if you're the other way. So when I turned 18, I wanted to be a flight attendant for Pan Am. I love to travel. I love to travel. And Pan Am back in the day, you had to be all fancy and rich to fly, and you had to be like tall and thin and skinny to be a flight attendant. And I actually went through the process, but I
Ooh,
was
I
afraid
that.
if I got, they would think I was dumb, but people would never know how smart I was. And I mean, I got a full academic scholarship. And if I thought, if I do that, no one will ever know how smart I am. Now I know that's BS. You can do both. But back then, my tape did not tell me that. So the story that is to pop out your cassette, take it apart, rewrite your story, put it back in your head. Okay. But everybody has a different story. So what is my answer?
Yeah,
D.
D.
Your story is based on your story. When you rewrite your story, you're not rewriting my story, it's your story.
Correct.
So narrative therapy. So remember the verbiage, because again, it might not say the words rewrite your story. It's about the tape you have in your head, rewriting that tape, taking it out, taking it apart. It's called externalize, deconstruct, reauthor, put back in your head. What's the ideal length of time for outpatient counseling groups? Groups are
An hour?
1 hour, an hour?
That's individual.
90 minutes.
90 minutes. Groups are 90 minutes. Absolutely. Half that for kids. The average group size is 8 to 10. Here we go. You know what these are? Last question, by the way, guys. I got stuff done today. Neurodevelopmental and neurocognitive. Does anybody know what those mean?
Neurocognitive is like dementia, right? And then neuro is the brain developing.
Absolutely. Neurodevelopment is brain development, right? Fetal alcohol syndrome, Down syndrome, right? As the brain is developing. Neurocognitive is in, as my brain is fully developed, I begin to lose cognitions, thoughts. Okay. So remember Alzheimer's, it's neurocognitive disorder. It's mild, medium, and severe.
Mild, major, right? It's major and mild, right?
Major, there's 3.
Major, mild, and I don't know the third.
Yeah, okay. So yes. I want to say like medium rare, but that's but yes. So you have the beginning stage of Alzheimer's, you have mild, right? When Bruce Willis first started and he lost his words, that was mild. Now he has severe, but it's the same diagnosis. It's called a neurocognitive disorder. Okay. So then what's true about that? Right on the same page there.
C, right?
Dang it. Okay, guys, I gotta wrap you up. Okay. I am leaving. I'll be gone December 20th through the 1st of January. Anybody live in LA? I'm looking for a place to spill. New Year's Eve, I'm taking a cruise out of LA. So we'll be in Mexico, but we're coming back on the 31st. So anybody, got any hints on me to stay at your house, LA, I'll throw in some free lessons, just we can barter or something. Just
I wish. I live in Francisco. You're always welcome.
Oh, where do you live?
San Francisco.
Isn't it cold there?
No, not today. But I was in LA too, and it's very nice.
I was gonna say I don't do cold. That's why we leave the country.
How long are you in LA?
Just for 5 days. So we're going 3 days before the cruise and 2 days after the cruise. So it's an 8-day cruise. So we'll be gone for like 2 weeks. So
can
I just
say-
wanted to make sure you guys know you need to, so my LMs, my LCs, and all of you actually, make sure that you're subscribed to our channel. But my LCs particularly, so the NCEs are just more clinical. And those are the ones that I really would suggest that you watch. So if you go to my YouTube channel, first of all, be sure you subscribe because we release new videos all the time. Okay, and then if you to my videos,
Let's see.
and then there's the playlist. But if you use the NCE playlist, you're going to get more of the clinical ones. So like the NCE prep, so they have to learn things about careers that you don't need to know, and the stats and research on that one are more than you need to know. But in general, those are just some really good about the diagnosis and the therapies and things that you won't necessarily see unless you're driving through the APGAR book. Okay. But in general, though, subscribe. Remember also that we have, if you want the quiet, you can buy a podcast. So our podcast channel is just my voice. I wouldn't suggest that, but I'm told I need to sell that. Okay, it's just my voice. So if you're listening in the car, you'll just hear me. It's just me talking. It's not necessarily a group session. Okay. Okay, and these groups, I'll tell you this also, these groups will be on YouTube in probably about 3 or 4 years. So if you don't want that, you can send us an email. We're going to go back and put something when you sign in to be aware of that. We don't release these, the new ones, we don't release them. The ones you'll see now were 2001, 2002, but eventually we'll release these as well. Okay, dokie. Other questions? Did you find today helpful?
Very helpful.
Yes,
Okay.
very.
Very
It's
helpful.
a reading test. It's a reading test. Take your time. Take your time. Don't speed through. And if you're finding that you don't have enough time, you probably just need accommodations to get more time. Okay. Bye.
Bye. Thank you so much.
Dr. Pam.
Thank you.
Who is that, Dr. Pam?